This is Margot. So excited to find out if she's gonna have babies.
Oh no,
We're
little puppies.
So excited.
Okay, I'll let Dr. Bott know that we're all ready for him.
How are you guys today?
We're good.
Well, we get to see if
Yes.
our artificial insemination was successful.
Yep, we're hoping for good news.
Yes. How is she acting? Any behavioral changes?
A little bit. She has, I don't know if it's just me hoping. She's a little bit slower, a little more of an appetite. She's not jumping on things as much as she used to, so.
She has been sleeping a lot more.
Oh, she sleeps a lot all the time.
I don't feel anything. Gosh, I'm going to take do a quick ultrasound and see. Alright, let's make her lay on her back. Hey, sweetie, you're okay.
And he's gonna try and get more tricky.
Okay.
Just do a quick ultrasound, okay?
She's gonna be okay.
So I'm just going to look at both sides of this uterus on both horns.
Okay. One puppy would be.
Margot, it's okay, baby.
So this is kind of a high-risk pregnancy right here. Yep, there's one right there. So we're just going to want to watch. I'm going to want to. Good. See the heart rate right there fluttering? I don't know if you can see the round black circle on the left side, right at the very top.
So you only see one.
That's all I can see.
Okay.
Ultrasound, sometimes it's tricky
Sometimes
to
it's
count.
hard to see them.
And so generally what we do is we take an x-ray at about day 50 to day 55.
Okay.
The heart rate and everything is okay. But I do see a lot of pregnancies that terminate
Okay.
at this, especially when there's one or two. It just seems to happen more frequently, and I don't know why, but on the caseload that I see, a lot of this, 1 and 2 puppies. Sometimes
Whatever,
will
1 or 2.
kind of abort.
Yeah.
And you don't really
Yeah.
see anything, you wouldn't see any
You wouldn't
discharge
be
or
able to
anything like
tell.
that. It just
Okay.
kind of is reabsorbed into the body. Gonna be
Huh,
fine,
we're just
so.
gonna wait another 3 weeks. Just crossing our fingers.
Well,
Yeah,
good.
just crossing
At least
our
there's
fingers.
something in there.
Good girl.
Margot was confirmed to be pregnant. I could only see one fetus on ultrasound. I actually artificially inseminated Margot about 30 days ago. Reproduction in veterinary medicine is called theriogenology. It's a fancy scientific word just to be an animal reproductive expert. And so I actually, as a veterinarian, perform a lot of reproductive work in a wide variety of species. So in my typical day, I do have reproductive cases: dogs and cats, reindeer, sheep and goats, elk, bighorn sheep, and it provides a huge variety for me. It keeps me absolutely engaged in what I'm doing, and reproduction to me has always been really a fascinating area of veterinary medicine. So on Margot, I can only see one fetus. I am concerned that that puppy will be big. It seems that a lot of the single pregnancies where there's just one fetus, the puppy seems to be abnormally large compared to a litter where there's several. So that's something we're going to watch very, very closely. With these pregnancies, my recommendation to my clients are that we ultrasound at day 30. This is assessment of the fetus. We're looking at heart rate. We're just looking at the attachment, make sure everything is normal. And then at day 45 plus, you can take an x-ray and actually see bones of the puppy and count how many fetuses there are. I have a really nice digital x-ray system here, and I like to take my x-rays between 50 and 55 days. I'm able to very accurately count how many puppies there are, and I'm able to actually measure their head versus the size of the pelvis, and a lot of times we can predict whether or not there's going to be any birthing difficulties.